Welcome to Heart Nurses, brought to you by the Preventive Cardiovascular Nurses Association. PCNA's mission is to promote nurses as leaders in cardiovascular disease prevention and management.
Thank you so much for joining us today. We have the opportunity to talk with Barbara Fletcher, who is going to be speaking with us about global cardiovascular disease prevention and international outreach. Barbara, why don't you give us a brief introduction about yourself?
I will. I'm one of the founding members of the Preventive Cardiovascular Nurses Association, and I am currently at the University of North Florida in Jacksonville, Florida. My background is clinical work has always been cardiac rehabilitation, exercise testing, training, and so forth, and my research has been in that field as well. So I'm on the international committee is probably the reason you've asked me to participate today on this topic. So I can speak to that from that committee.
Wonderful. Well, before we get too far into the international realm, I'm just really curious. You are a seasoned professional, and I'm wondering what advice you would give someone who's just starting out in their nursing career.
Just starting out. Well, first of all, it comes to mind to be a team player. We have to be, and I have been that all my career, and it's paid off. Cardiovascular care is getting so complex. It's unbelievable. I'm glad I'm on the twilight of my career, not just starting out. But it is complex. There's nothing simple about it. And so, I think that alludes to the fact that it's even more imperative to have a team that you can count on, that you can go to, and that you can delegate and so forth. And I think the other thing that would come to mind, we had the buzzwords now, patient-centered care and shared decision making. And I do think we as cardiovascular nurses have really participated in that. We didn't call them those fancy names, but we've done patient-centered care all our life. We've done shared decision making. Shared decision making and patient-centered care are here to stay, and I'm glad it's finally defined by professionals, because it means a lot, and I think it is improving clinical outcomes. So I would say, just to summarize your question, I would emphasize the team approach, and I would emphasize to continue with patient-centered care and shared decision making.
So it definitely takes a lot of skills beyond what we learn in nursing school to be a great team member, to know who to go for information. They might be within your current network, wherever you're working, or it might be beyond that. Right. So I'm actually curious, Barbara, how you might suggest for a new nurse how they might develop these relationships with people that perhaps they don't have in their inner circle of people that they have at work. What kind of strategies would you suggest to them?
Well, I think, it actually depends on the personality of that cardiovascular nurse. And some, it goes back to all of us. Some are more introverted, some are more extroverted. You really got to have that relationship with other people. And, it's just, that's the name of the game. You can have your inner circle, which is good, but you also, that inner circle gives you the opportunity to reach out. And you reach out, through, I think, it's major organizations like PCNA, like American Heart, and then you develop a network that you need around the globe, if you will.
Great. What a wonderful suggestion. And I think one of the things, as you are starting out in a new career, and maybe you are starting out in a new organization with which you're not very familiar, just finding what works for you, and obviously, of course, what works for your patient, and building the best team you possibly can. Yeah. So thinking about the role of a nurse in cardiovascular disease prevention as part of this team that we are discussing, what kinds of things would you want us to know about that role?
Well, let me just say that I think prevention, whether you're talking primary, secondary, tertiary, spans every patient. So it should be included in anything you do. I don't care if the patient's being treated for heart failure, atrial fibrillation, transplant. We need to incorporate prevention. And ironically, I pulled this off. This is American Heart Association's annual heart disease and stroke statistical update. And it's you can get the full thing on the web, but it highlights 8 bullet points. And of those 8 bullet points, 6 of the 8 are prevented. For instance, here I'll just paraphrase some of it. 9.8 million adults have undiagnosed diabetes. 28 million have diagnosed diabetes. 114 million adults have prediabetes. So that's huge. And so we can address prevention. And when I say prevention, it's lifestyle intervention, but I don't think we can forget the therapies and the medications. These go in, medication adherence is certainly part of prevention. So diabetes. Next bullet is hypertension. We've got 48% of U.S. adults with hypertension. The next bullet is high LDL cholesterol. We have 28% with elevated cholesterol currently. And then this is scary. The next one is related to e-cigarettes, and 1 in 5 high school students in the United States used e-cigarettes within the past 30 days. So those just a few. Then 10% of U.S. adults don't even come near meeting the dietary guidelines that of our heart healthy diet. And it's just other things like exercise. If we could increase 1,000 steps a day, then that would be associated with a 10% lower metabolic syndromes. It alludes to the fact of the benefits of physical activity in our cardiovascular patients and outcomes. So based on that, I strongly believe we have to do prevention across every patient that we see.
So being part of an effective team, helping a patient have the best outcomes to prevent cardiovascular disease, you've described as definitely something that every nurse everywhere is responsible for in whatever perspective they can provide. So you have seen some changes in cardiovascular disease prevention and management over the years. And one of the things that I have noticed in talking to speakers in recent times is just it used to be that everybody had their specialty, and, for example, a cardiovascular nurse was not as involved in diabetes care. And so we're seeing a lot more overlap, a lot more involvement, a lot more relationship building outside of the cardiovascular field. And would it be accurate for me to say that a cardiovascular nurse is more like a traffic director in some ways as well as those other descriptors that you have used? Because a lot of times they're navigating insurance, they are trying to make sure that their patient gets an appointment at the next specialist's office, that they are working with endocrine or nephrology or whatever it is. So is that an accurate assessment?
That's a very accurate assessment, and I think what you're alluding to is case management, which we have some very expertise in cardiovascular nursing efforts here in case management. Come into mind the group at Stanford, the group at Hopkins. We have excellent research showing better clinical outcomes with case management. So I think that's a very important point.
Great. Well, we're going to take a quick break, and we'll be right back with Barbara Fletcher.
For more education, resources, and tools for your clinical practice, visit PCNA.net. You'll find CE courses, patient handouts, and more, all free to access. Visit PCNA.net.
And we're back with Barbara Fletcher. We're going to switch gears just a little bit and focus a little bit more outside of the U.S. and thinking internationally in scope. So I know that the Preventive Cardiovascular Nurses Association has worked internationally for quite some time, but I'm wondering if you could talk a little bit about the Global Cardiovascular Nurse Leadership Forum.
Yes, and it's very near and dear to my heart because I was on that committee when it started. The mission of, we call it GCNLF, Global Nursing Leadership forum is to promote the role of nurses and nursing in global cardiovascular prevention and management across the lifespan. So that is built right into it up front. What we're trying to do through the global leadership and international outreach is elevate the role of nurses around the world. And we're going to do this, I think, by we're trying to level the playing field, if you will. And that being said, PCNA leaders with international nurse leaders has developed a nursing certificate program, which I think will address that. I know will address that. The certificate program includes many aspects of education on cardiovascular disease, but prevention is certainly among that. And this promotion of this certificate through GCNLF is going to enhance cardiovascular nursing worldwide. If cardiovascular disease is largely a byproduct of lifestyle and genetics, and our job is to ultimately prevent this. Now, genetics is another thing, but we certainly have expertise in behavior change to address prevention, and we have the responsibility to include all those complex therapies, whether they be the new medications that are coming out, that we can really make a difference in prevention. We have the tools at our side now.
So some nurses have full prescribing authority, depending upon where they are. Others might just be seen as an assistant in procedures, might be have more of an administrative, otherwise known as a secretarial perhaps role, depending upon where in the world they might be. So the Global Nursing Certificate is intended for them to increase both their knowledge and their skills, as well as their competence and confidence in being able to attend to all the needs of all these patients that are increasing in number, that have comorbid conditions, so they're very complex, and that can, again, lead towards better patient outcomes. Are there any other things about the certificate program that you would point to in terms of importance that our audience should know?
Yeah, well, first of all, you can find out more information about the Cardiovascular Nursing Certificate. It's not a certification. I think it's an important factor here. It's not something you have to renew. Once you have it, you have it. It's a certificate that you have taken this program and achieved a passing grade. So, and it's like 12 modules. It's interactive. It's online. So you don't have to go somewhere to take it. And these 12 modules, like I think I previously said, it does have prevention included. It takes about 15 to 18 hours to complete the 12 modules. And we would hope that they would complete it, at their leisure, but in about 3 months. It's going to elevate the role of nursing, as we've been talking about, on the global scale, and we're going to improve, most of all, clinical outcomes. I think it's going to be very important.
So this certificate program, is it available for people here in the U.S. to take as well as people elsewhere?
Oh, yeah, sure. Yeah, okay. It is.
Great.
Yeah. There is a cost, but there are scholarships available as a minimal cost.
So, Barbara, I know you have a lot of experience in interacting with international audiences who are nurses, and I'm wondering what similarities you see between the complexities of the things that they are trying to accomplish and the things that our nurses that might be listening are. Obviously, we've talked a little bit about how there's some differences in terms of scope of practice and how they're seen by other professionals and maybe even seen by their patients. But what similarities do you see between all these global cardiovascular nurses, no matter where they are?
They are all extremely interested in cardiovascular prevention, and the programs and the organizations like Chilean Society of Cardiovascular Nurses, the European Society of Cardiovascular Nurses. They all are very common, have things in common, and I think that they are very dynamic organizations around the globe. So I think we all have the same mission, we all have the same goals, objectives, and I think that's how we're going to really make a difference.
Great. Is there anything else about nursing in general or international nursing that you would like to share that I've neglected to ask about so far?
Well, let's see. No, I think we need to keep nurses in the forefront. We are the most trusted profession, and I think that makes a difference in achieving goals that we want to achieve.
I would agree that being the most trusted profession is something that we should not take for granted.
No.
That in spite of all the things that have happened during the COVID pandemic and other things that are happening, that we know that what we do every single day makes a difference to our patients, to their families, to their caregivers, and together we are making strides towards cardiovascular prevention and management across the globe.
We are.
Well, thank you so much for being with us today, Barbara Fletcher. We have so enjoyed having the opportunity to speak with you. This is your host, Geraldine Warfield, and we will see you next time.
Thank you for listening to Heart Nurses. We invite you to visit pcna.net for clinical resources, continuing education, and much more.